Dr. Mills, and I'm a psychiatrist in California with my own private practice called Freedom Psychiatry, because mental health is freedom. My practice focuses on achieving mental wellness using medications, nutrition, and lifestyle changes. I will be posting videos on a regular basis that answer common mental health questions. Today, we're talking about the difference between seeing your primary care doctor and a psychiatrist for your mental health treatment.
Hi, Dr. Mills. Here's a question. Do I need to see a psychiatrist or can I just go to my primary care physician?
I'm so glad you asked that question. I get this a lot. So, you can go to either, it's your choice, and everybody has their own preferences on who they like to see, either their primary care or their psychiatrist for mental health treatment. But it's really important to know that there's a very big difference between the two. Primary care doctor and your psychiatrist have very different training backgrounds. A primary doctor has training in either family medicine or internal medicine. And then a psychiatrist is trained in psychiatry. So even though both of them are medical doctors and they both went to medical school for 4 years, the training that they had after medical school, which is called residency, was vastly different.
Okay, Dr. Mills, that's interesting. Um, can you please tell me more about the differences between a generalist and a psychiatrist?
Yeah. So your primary care is what we call a generalist, and a psychiatrist is a specialist. So the generalist focuses on taking care of the entire body, all the different body systems. The psychiatrist, on the other hand, will be trained and will focus just on your mental health concerns. Now, when things become more complicated or things are kind of outside the norm, then a generalist usually will refer to a specialist. So, if we're talking about a psychiatrist who is a specialist, they have specific training in how to treat mental health concerns. While the generalist covers a wide breadth of health concerns with little depth, the psychiatrist goes into one specific thing, mental health, in a lot of detail. Your psychiatrist is specially trained to treat mental health concerns, and they will spend a lot of time with you talking about it. They have skills and knowledge that go beyond what most primary care doctors have about mental health treatment.
Excellent, Dr. Mills. Thank you very much. So, compared to generalists, what types of things do psychiatrists do differently?
Well, there are several things that are different. The first thing is that the psychiatrist is likely going to spend much more time with you than your primary care doctor. The psychiatrist does the entire time is focus on only your mental health concerns, while the generalist or your primary care doctor has to actually go and cover your whole body and all of your body systems concerns. So the amount of time that you get that are spent on just your mental health concerns with a psychiatrist is significantly more. The other thing that's different is a primary care doctor is usually going to conduct a physical exam, listening to your heart and lungs, whereas usually psychiatrists don't do that. The exception is actually sometimes when someone is taking a class of medications called antipsychotics, those medications can cause side effects that can make people feel stiff. So, in order to check for that, the psychiatrist will just check your limbs for ease of movement to make sure that you're not feeling stiff. Something that actually both doctors do is they want to make sure that your mental health concerns aren't actually a physical health concern that's masquerading as a mental health concern. In order to do that, they'll do some blood work and a urine test to check and make sure that you're physically healthy as well.
That makes sense, Dr. Mills. Thank you so much. But I heard psychiatrists don't take insurance. Is that true?
Well, it depends. In general, the cost is more to see a psychiatrist because a psychiatrist is a specialist. And some psychiatrists do not take insurance. While your primary care doctor, most of them do take insurance, unless you go see what's called a concierge medical practice. But that's out of the scope of this topic. Though it costs more money and you may have to pay out of pocket for psychiatry, I would argue that it's well worth it. You're going to have a specialized physician focus completely on your mental health, spending more time and energy on that. You might want to ask yourself, what's my peace of mind worth? Is it worth it to live my best life? I would argue that it is. To help with the cost of seeing a psychiatrist that doesn't take insurance, you should ask for a super bill. A super bill is the paperwork that a psychiatrist can give you, and you will take that paperwork and submit it to your insurance company for partial reimbursement of your out of pocket costs.
That super bill idea is a great idea. Thank you very much, Dr. Mills.
You're welcome.
I have one more question. I know a psychiatrist can help me, but I'm so scared to see a psychiatrist. How can you help me?
Well, as you remember, or you may not if you haven't seen my video, it's very common to have a fear of going to the psychiatrist. So it's okay to feel a little nervous. Remember that it's just a conversation between you and the psychiatrist. It's confidential, and they should help put you at ease. If you want more details of what happens during your psychiatrist visit, please review my video called Fear of Visiting a Psychiatrist for more details about it. Hopefully that'll put you at ease. I do recommend visiting a psychiatrist whenever you have mental health difficulties. The time and money that you invest is well worth it. Once your psychiatrist says you are stable, you can always ask your primary care doctor if they're comfortable in providing you refills of your psychiatric medication, with the idea that in case something comes up with your mental health issues, again, that you go back to see your psychiatrist for further assessment. But you never know. You may find that you prefer seeing your psychiatrist for all of your mental health issues. You know, even if it's just for a check-in.
I love it.
If you would like me to be the psychiatrist to accompany you on your mental wellness journey, please go to my website, freedom-psychiatry.com, click on the book appointment button, and schedule your 15-minute free consultation with me, Dr. Mills. Thank you so much for listening. Have a great week. And remember, mental health is freedom.